That sudden change in your urine color or an unexpected sharp pain can be pretty alarming. A lot of people worry that it's something serious, but often the clues to what's happening inside your body appear in the toilet bowl first. Recognizing these urinary symptoms early can lead to timely medical help, preventing complications. This article will highlight the top 5 urinary changes that could indicate kidney stones, supported by clinical signs and expert insights, to help you understand when it's time to seek medical advice. Number 1. Blood in the urine, hematuria. One of the most common and noticeable signs of kidney stones is having blood in your urine, a condition known as hematuria. This can make your urine look pink, red, or even brownish, kind of like tea or cola. This color change is a direct result of bleeding somewhere along your urinary tract, from the kidneys all the way down through the bladder and urethra. Now, seeing blood can certainly be unsettling, but it's a clear signal that something is irritating the delicate tissues inside your urinary system. It's also important to understand that this blood in the urine or hematuria can show up in 2 ways, visible or microscopic. Visible hematuria is pretty straightforward. It's when you can actually see the blood with your own eyes. But sometimes the amount of blood is so small that it can only be found with a microscope during a lab test. This is called microscopic hematuria. You might have no idea it's even there until a doctor runs a urinalysis, which just goes to show why those routine checkups are so valuable for catching problems early. So, why do kidney stones cause bleeding? Well, it's a purely mechanical process. As these hard, crystal-like stones move through the narrow passages of your urinary tract, their sharp, jagged edges can scrape against the delicate lining of the kidney, or the ureter. That's the tube connecting the kidney to the bladder. This scraping and irritation causes tiny blood vessels to break and release blood into the urine. And interestingly, the amount of bleeding doesn't always match the size of the stone. Even a small, sharp stone can cause a lot of irritation. Now, while small amounts of blood are a common symptom of kidney stones, if you see a large amount of blood or start passing blood clots, that's a sign to get immediate medical attention. Significant bleeding could point to a more severe injury in your urinary tract or another serious condition. A healthcare provider can run the right tests to figure out the cause and make sure you get the proper care to avoid any further complications. So, blood in the urine is a very direct sign, but our next symptom announces itself with a distinct and very uncomfortable sensation. Number 2, pain or burning during urination, dysuria. Moving on to our second point. Another telltale urinary sign of kidney stones is a sharp, stinging, or burning feeling whenever you urinate. This symptom, which doctors call dysuria, can range from just mildly uncomfortable to intensely painful, turning a simple bodily function into something you dread. The pain is usually at its worst when the stone is moving through the final stages of the urinary tract, especially as it passes from the ureter into the bladder or from the bladder out through the urethra. It's really easy to mistake dysuria for a urinary tract infection, or UTI, because that burning sensation is a classic sign of both. A lot of people might first think they have an infection and put off getting medical advice, hoping it'll clear up on its own or with some home remedies. But if a kidney stone is the real cause of the burning, delaying could mean prolonged pain and possible complications if the stone creates a blockage. That's why getting a professional diagnosis is so important to tell these 2 common problems apart. The reason for this painful urination is directly tied to the stone's location. When a kidney stone travels down the ureter and gets stuck where the ureter meets the bladder, it can cause a lot of irritation and inflammation right in that spot. This inflammation makes the surrounding tissues incredibly sensitive. So, when the bladder contracts to push urine out, the pressure and the flow of urine over this irritated area is what triggers that sharp, burning pain. Understanding why this symptom matters is really crucial for your health. If you feel a burning sensation when you urinate, especially if it comes with other kidney stone symptoms like pain in your side or blood in your urine, it's really important to see a healthcare provider. Figuring out what's causing the burning allows for the right treatment. If it's a kidney stone, dealing with the stone is the priority. If it's a UTI, you'll need antibiotics. Ignoring the symptom can lead to worse pain, or if it is an infection, the risk of it spreading to your kidneys. Beyond just pain, a kidney stone can also disrupt the very rhythm and timing of your urination. Number 3, urgent and frequent urination. A persistent, nagging feeling that you need to urinate, even when your bladder isn't full, is another key urinary change linked to kidney stones. This symptom often shows up as a sudden, compelling urge to rush to the bathroom, combined with needing to go much more often than what's normal for you. This urge can strike out of nowhere, disrupting your daily activities, causing anxiety when you're out, and even waking you up throughout the night. This disruptive change in your bathroom habits can really impact your quality of life. The constant need to be near a restroom and the stress of a sudden, uncontrollable urge can make it hard to focus at work, enjoy social events, or even run simple errands. This is a direct result of the physical irritation the kidney stone is causing. It's not a sign of poor bladder control, but rather your body's physiological response to an internal irritant. The underlying cause of this urgency and frequency is often the location of the kidney stone. When a stone travels down the ureter and settles near the bladder, its presence irritates the sensitive bladder wall. The bladder mistakes this irritation for a signal that it's full and needs to be emptied, which triggers the powerful muscle contractions that create that feeling of urgency. This happens even if there's very little urine in the bladder, leading to frequent trips to the bathroom with not much to show for it. When you experience these symptoms, getting a proper diagnosis is important. A healthcare professional will need to figure out whether the bladder irritation is from a kidney stone or something else, like a urinary tract infection, an overactive bladder, or interstitial cystitis. An accurate diagnosis often involves a urinalysis to check for infection or blood, as well as imaging tests like an ultrasound or CT scan to look for stones. Identifying the root cause is the only way to get effective treatment. So, in addition to how often you go, changes in the very appearance and smell of your urine can also signal a problem. Number 4, cloudy or foul-smelling urine. Healthy urine is usually clear and has a pretty mild, faint odor. So, a noticeable change, like urine that looks cloudy, murky, or develops a strong, foul smell, can be a warning sign of kidney stones. This change in clarity and scent often points to other complications arising from the stone's presence, like an infection that needs prompt medical attention. The cloudiness is usually caused by pus, which is made of white blood cells your body sends to fight an infection, or by certain crystals related to the stone itself. The science behind this symptom is straightforward. Kidney stones can create an environment inside the urinary tract where bacteria can easily grow. A stone can block the normal flow of urine, causing it to become stagnant. This stagnant urine is the perfect breeding ground for bacteria, which leads to a urinary tract infection. The infection then produces the pus and waste products that make the urine cloudy and give it that unpleasant, strong odor. When you have foul-smelling or cloudy urine, along with other kidney stone symptoms like pain or a fever, it can signal a serious medical issue. An infection combined with a kidney stone that's blocking the urinary tract is considered a urological emergency. The blockage stops the infected urine from draining, which can cause the infection to back up into the kidney and potentially spread into the bloodstream, a life-threatening condition called urosepsis. This situation often requires urgent surgery to drain the kidney. Because of this, It is vital to watch for any additional signs that might come with cloudy or foul-smelling urine. If you notice these changes along with a fever, chills, severe back or side pain, nausea, or vomiting, you should seek immediate medical care. These accompanying symptoms are a strong sign that a simple kidney stone has become complicated by an infection, and you need swift treatment to prevent severe health consequences. And finally, let's talk about the most direct impact a stone can have, which is physically stopping the flow of urine itself. Number 5, decreased urine output or difficulty urinating. One of the most concerning urinary changes with kidney stones is a noticeable drop in how much urine you produce or significant difficulty just starting to urinate. This symptom suggests that a stone has moved into a position where it is physically blocking the flow of urine out of your kidney or bladder. While you may feel the urge to go, you might find that only a small trickle comes out, or you may be unable to urinate at all, no matter how much you strain. The severity of the symptom really depends on whether the blockage is partial or complete. A partial obstruction might just cause a weak stream or a slight decrease in urine output. A complete obstruction, however, is a medical emergency. If a stone completely blocks a ureter, urine can't drain from that kidney. If both ureters are blocked, or if a person only has one kidney and it gets blocked, it can lead to acute kidney failure. This requires immediate help to restore urine flow and protect your kidney function. This buildup of urine behind the blockage often leads to other distressing symptoms. The main one is typically severe, unrelenting pain in the back, side, or abdomen as the kidney swells up with trapped urine. This intense pain often comes with a feeling of restlessness, since it's impossible to find a comfortable position. Nausea and vomiting are also common, triggered by the severe pain and the body's response to the kidney's distress. It is crucial to know the warning signs that mean a blockage needs urgent help. If you experience a sudden and major decrease in your urine output, or if you can't urinate at all, you must seek emergency medical care without delay. This is especially true if the symptom is accompanied by intense pain, fever, or vomiting. Getting prompt medical attention can relieve the obstruction, prevent permanent kidney damage, and manage the pain effectively. Distinguishing stone symptoms from UTIs and other conditions. Many symptoms of kidney stones, like painful urination and urinary urgency, overlap with those of urinary tract infections. However, the presence of severe wave-like pain in your back or side is much more indicative of a stone. In contrast, UTIs are more likely to come with a low-grade fever and a persistent discomfort in the lower abdomen. Because these conditions can seem so similar, trying to self-diagnose is risky. A professional evaluation is essential for any persistent or severe urinary symptoms to make sure you get an accurate diagnosis and the right treatment. What causes kidney stones? So, what causes kidney stones in the first place? Well, they form when your urine contains more crystal-forming substances like calcium, oxalate, and uric acid than the fluid in your urine can dilute. At the same time, your urine might not have enough of the substances that normally prevent these crystals from sticking together, creating the perfect environment for stones to form. Dehydration is a major risk factor because it concentrates these minerals in your urine. A diet high in protein, sodium, and sugar can also increase the risk for some people. Staying well hydrated by drinking plenty of water is one of the most effective ways to prevent stones from forming. Recognizing urinary changes is key for the early detection of kidney stones. Whether it's blood in the urine, pain when you go, a constant urge to go, an unusual odor, or a reduced flow, your body is sending you a clear signal. Paying attention to these signs and seeking a prompt evaluation from a healthcare provider can help you manage the condition effectively and prevent serious complications. If you found this guide helpful, please share it with friends and family who might benefit from this information. For more essential health updates, be sure to subscribe to our channel. We also invite you to leave a comment below with your own experiences or questions to help our community stay informed.